This class, Sam took intro tie with us. This class is like completely different. With intro tie, I'm giving them a sequence so they have something to fall back on. I'll never crack open that table tie book. I'm going to ask them, what do y'all want to work on? And we'll go to that and treat that area. And then they'll say, what do you want to work on? And then they'll go to another area. And I'll just keep doing that for 2 days to give them a piece that they can add because they're already working on a table. When they're working on a mat, the challenge is I have to give them enough of a effleurage kind of sequence, a flow, so that they have something to fall back on. I set the table height at the height that I would normally do Swedish and deep tissue because it allows me to come in, do some table tie stuff, and then like leave and go right back without having to adjust the table. If after this class you're like, Robert, I know you do that mat stuff, but I'm most interested in table work. You need a hydraulic table.
Mine's coming in next month.
The hydraulic table makes a big difference. Why have you not made the jump to the mat?
Well, I'm just teaching, well, this is just my thoughts,
Yeah.
is that all my clients have been on a table so far. I'm just now getting them in about the last 3 months into more tie, and got tie on the menu now on the table.
That transition, if you got a table tie client, they're easier to transition
So
to the
now
mat.
that I'm getting them
If you have a
into
Swedish
tie-
client, that's
Right.
harder.
So I'm kind of just slowly maneuvering them in, and then, I don't know, I might try mat later.
Yeah.
But
Yeah.
right now, I'm in the transition of I'm getting more and more clients to rebook and book table tie now.
They trust you.
Yes.
When you build that trust in them and you go, here's what you say. When you decide, I want to try some mat stuff, you take those regular clients who love the table tie and say, listen, the guy I study with, like I want to try the mat. He's got a bunch of support materials. I really would like give him a steep discount to get on the mat and practice. What's going to happen is mat work, and I'm a huge proponent of mat work.
I know you just
It's
did
gonna
3 days
it's
of
gonna
mat work.
double. It's going to double the potential tools you have.
Okay.
And are you thinking?
And then one of my bad thoughts is that
Bad thoughts.
I just turned 59 this week, and I'm like, is that hard being down there on that mat, or?
You're going to be more mobile. You're going to be more flexible. You're going to have more core strength. You're going to burn more calories, and you're going to kick ass all over Southern Arkansas.
Okay.
And we'll talk more about that. So Sam, Sam, Thailand. She comes in and it breaks my heart because she has like totally different issues, right? Because I'm a white guy teaching Thai massage, and like she's Thai trying to get white, and she's said this. She's working on somebody and she goes to work on their legs and they're like, "Aren't you gonna massage me?" And I'm like, "Oh my God." I lived in her world for a second, and they won't, like, this is her people's work, and they won't let her do it. Like I don't have to teach her the work as much. I have to teach her how to package it to be able to give it to them and ease that transition.
And
If
get
you,
them out of the.
yeah, the students sometimes think that, like, because I'm a big mat fan. If you never do mat work, you are still the most glorious therapist on earth. Don't feel like it's inadequate. That's not what I'm saying. The size of the canvas changes the art.
Yes.
That's what I'm saying. When you have problems with, you said your cervical spine, is it like low neck or like upper?
Right in here and right in here. That's
Right in there?
Yeah, that's hidden in.
Okay. The way that I'm first going to work on this is I'm going to come in and go, hey, if I pull down this way, where do you feel that?
Forearm.
This is me establishing contact because how do the clients feel when I come in and do this?
What are you doing?
Yeah, could be. And I hook here and go, listen, how's that?
I mean, people have never had
Feeling
it.
that right where your hand is and up.
So you feel it like where my hand is, you said, and then up?
Yeah, right about.
Is it kind of pulling through that neck stuff?
Yeah, and right up here.
I think in video, sometimes the stuff looks inordinately boring. Massage therapists think I'm working on the shoulder because you can only work where your hands are.
That's true.
And I'm tense through the spine, so I feel a lot of twisting movement.
She knows she's not going to fall off the table because I've established this passive body contact and I can just lean. This is just me pulling, but you see this little cervical rotation she's going through, this little bit of movement. When I pull, do you prefer down, like towards your feet, or back?
Back.
Right there.
And I'm feeling that. Oh, you're popping stuff.
I'm popping stuff.
Yeah.
She had a spontaneous cavitation. How's that right there? Do you prefer the rocking or static?
Rocking.
When you say you prefer, are you saying that's
Actually,
doing
it's
more?
pulling a little less physically on the skin.
Okay.
And I'm feeling a little more, when you're doing the pop, it's kind of an ease and pull, ease and pull. Yeah. Oh my God.
Shoulder feel better?
Yeah.
Spontaneous cavitation. I guarantee the mic picked that one up. That was her shoulder joint. I wasn't even really thinking shoulder joint. I'm mobilizing the shoulder girdle to mobilize her upper thoracic into her cervical spine. When I pull down like this, and this is something we have to be real clear about. It's a real simple move. Let me see what I got set up here. No, yeah, so we're open up pec and pec minor. It's in the front, right? Mm-hmm. When I'm pulling back, what I'm really doing is lengthening pec and pec minor. I'm pulling those muscles open. When I dealt with women, what was most interesting was breast tissue fell down and forward. I was up here underneath the arm, but it didn't feel untoward in any way at all. Like their notion of what was going on was very, very different. It gets into the neck because as I'm pulling down and her head would lift, it would start to lengthen some of the cervical paraspinals, right? But then it's also lengthening levator scapula. It elevates the scapula, lifts the shoulder blade, and she's pointing on my back saying she felt it in my mid-thoracic. Right in there. The issue is it's also lengthening the upper trap from origin to insertion because muscles cause movement, and I'm using movement to assess where she's having a problem. Take off your shoes and lay down on the table so I can assess. Do they want to hear that? Do they even know what assessment is?
Sounds intrusive almost.
Well, we're going to manipulate soft tissue today. Do they want to hear that? I say, hey, listen, take off your shoes, lay down on the table. I want to move you around to see where we're going to work. Just that. I only really did one thing. I kind of tractioned your arm first just to see, okay, is that uncomfortable? No? All right. Then I went into something that's a little more intimate where I sit pretty much at your sacrum. I'll put my leg on the table. And then when I hook under, I'm going to start to roll the pec open, lengthen trapezius, levator scapula. And I was giving her a choice. Does she want to go down or does she want to go back? Or maybe it's a combination. Maybe it's 45 degrees. Like a little, she's literally rolling onto my leg here. She had that clunk through her shoulder. Now stand up for me. What does that right shoulder feel like compared to the left?
It feels like it's down a lot more than this one.
How many times did I use my hands to push on her? Western effleurage-based massage and deep tissue is push. Whereas Thai massage did this crazy thing where I felt like it was more balanced between push and pull.
What about on this side where it is broken? You can see it pretty good.
I'd do exactly the same thing. I'd be more gentle and I'd ask for way more feedback because she'll tell, if anything's uncomfortable, she'll tell me. I didn't know I was pulling on skin. She told me that verbally. That's the danger if you're doing chronic pain stuff. If you're not communicating with them, they don't really know what they should be telling us. We have to ask the more pointed question. Does that make sense? I want you guys just to give and receive that one piece, and then I want feedback from the receivers on like how their upper back and neck feels just from that.